My name is Kate Seal. I'm the Assistant Director here at RSVP of Dane County, and I want to welcome everyone this morning to the virtual presentation. We're really excited to have Ashley Hillman here today from Safe Communities. She's actually working from a local safe community, but joining us all the way from Indiana today. So we're happy to have you. Thank you, Ashley. She has a presentation for us. So let's make sure that everyone has um, yourselves muted so that we don't have any disruptions. But certainly, Ashley, you can let us know if you want us to ask questions as we go or wait till the end. Um, but we're excited to be here. Thank you, everyone, for coming. And Ashley, it's all yours.
All right. Thanks, Kate. And definitely interrupt in the presentation if you have questions that come up. This is not formal, so just hop in whenever you wish. So my name is Ashley Hillman. I'm the Director of Program Partnerships at Safe Communities, and we are a nonprofit organization that is built off of a World Health Organization model where we look at the top causes of injury, death in a certain geographic area. So that's Dane County for us. And then we build coalitions around those issue areas. So in Dane County, those issue areas are suicide, traffic crashes, drug poisoning, and falls among older adults. So I will be talking specifically about falls today. Um, we'll go through the outline. But I've had the opportunity to work with many community partners in Dane County on falls prevention and resiliency efforts. So you'll see a lot of those connections throughout the presentation. So I will go ahead and share my screen and hope that all works. Can everyone see this?
I can.
All right. Okay, so as I mentioned, we build coalitions around top causes of injury death. So for falls, that's the Falls Free Dane Coalition. And we'll talk a little bit about who is part of that coalition as we go through the presentation. So let's jump right in. So what we'll talk about today is why we should care about falls. We'll look at a questionnaire that is available on our website, on the CDC website, and that you can do with me during the presentation or at home. We'll talk a little bit more about the Falls Free Dane Coalition, effective falls prevention strategies, the role that home safety plays in fall prevention. We'll talk about the balance stamp of approval, which is some exciting work that's happening in Dane County. I'll show you a little bit of the website, what our website has to offer, and then questions anytime throughout any of this. So just to kind of kick us off, I'm probably preaching to the choir here, but just some statistics about falls. 1 in 4 people 65 and older will fall each year. And those are falls that are reported. So we think that that number actually could be higher. Each year, 3 million older adults are treated for a fall injury, and more than 95% of hip fractures are caused by older adult falls. This data is a little bit out of date. You can see it goes up through 2020. This is the most recent we have for this particular data point. And really the point of this is to show that the population 85 and older is really the population seeing the most dramatic increase in death from falls. So that's just, it helps inform some of the work that we're doing and the outreach that we're doing. Just some more data points, and this is from the Falls Free Wisconsin Center. Over 47,000 older adults in Wisconsin went to the emergency department for a fall in 2022. You can see the cost. Hospitalizations in Wisconsin for older adult falls cost 427 million, which was actually an increase from a prior time period. An estimated $1 billion is spent annually on fall-related health costs in the state of Wisconsin. And more older adults in Wisconsin die from falls than motor vehicle crashes. So I have to say up front, this is somewhat doom and gloom, but I just want to kind of set the stage for why at Safe Communities we rally behind falls. I think a lot of people just aren't aware of how much of an issue it is nationally, well, probably worldwide, but specifically looking at Dane County. but it gets much more positive from here, so don't worry. Okay, so this is some more data. So let me start. This particular data is deaths from older adult falls. So you can see here, Wisconsin is very dark. Which means we have the highest rate in the nation for fall related deaths. So I will say though, Wisconsin does not have the highest number of falls, per capita. So it's the deaths. And so there are many reasons why we think this might be. But regardless, the point is that falls are a huge issue and that we can do a lot to help prevent them and to help increase resiliency among everybody because we're all aging. So that was Wisconsin. So now if we drill down a little bit further into Dane County specifically, you can see that the falls are the number one cause of injury death, and I'll break this down a little further. A great question came up in a presentation a couple years ago. What was the age, the age range? What are we looking at? And this is everybody. So this is from birth to, 150. But if we drill down further, we can see that it really is the 65 plus population experiencing those falls. So, we see the numbers are pretty small in these other categories. So we know that falls among our older population are most prevalent. This is a little bit of good news, I have to say. So when we look at Dane County, which is green, that means there has been either a decrease or no change. And I think it's actually, we've had no change. This is for the time period 2016 to 2020. So this data is a little bit outdated, but that makes me think, maybe we're on the right trajectory. The community work that we're doing is hopefully making a difference. This is some data from EMS. So we're able to get very timely calls to 911 for falls data from EMS. So you can see the trends over the past several years, and even broken down by month. And we actually had our Falls Free Dane Coalition meeting this morning and had our annual EMS Calls for Falls presentation. And what we learned is that when the weather starts to get warmer, when people are out and about more, that's where we do tend to see higher rates of calls to 911 for falls. And that's kind of consistent throughout. One thing also is February often sees kind of a spike, and I think that it could be attributed to ice and some winter weather conditions. But again, this is just to show you kind of some trends that we've seen over the years, specifically as it relates to calls to 911 for falls. And this is also data that we get from EMS in the darker spots in Dane County are the areas of our community that have higher rates of falls. So you can see, the isthmus right there in the middle, there are a lot. But if you kind of take that piece out, the areas that are darker would be Stoughton, Verona, Fitchburg, Middleton. So we can use this data to help as a coalition to help us know, gosh, like what's going on in Verona? Why don't we partner with organizations there? We have a great relationship with the senior center. Let's put on a falls event. Let's like get some education out there. So this data really helps inform the work that we as a coalition do. So here's this questionnaire. I invite everyone to participate if you are comfortable. But I think every time I go through this, it's really helpful just to kind of reset and really reflect on, might I be at risk of falling? So we'll go through this together. This is again on our website, the CDC website, and I can share the presentation afterwards too. But so we're going to ask these questions. Feel free, you can raise your hand or just in your mind kind of tally. If you answer yes, that's 2 points for some of these questions, one for some, and if no, then zero. And then we'll add that up at the end, and that will kind of tell you what your risk might be for a fall. and why, which I think is the most important piece. So I have fallen in the past year and I will participate too. I took a really, really bad fall. I was actually roller skating and I'm not sure why I thought that would be a good idea. It was a lot of fun though. Okay, so I have fallen in the past year. So this is important because people who have fallen once are likely to fall again. Number two, I use or have been advised to use a cane or walker, some sort of assistive device to get around safely. The reason this matters is because people who use assistive devices are already more likely to be at risk of falling. Sometimes I feel unsteady when I'm walking, so that could be a sign of poor balance. I steady myself by holding onto furniture when walking at home. Again, could be a sign of poor balance. I am worried about falling. This one was the most surprising to me because research has shown us that people who are worried about falling are actually more likely to fall.
Mm.
I need to push with my hands to stand up from a chair. This could be a sign of weak leg muscles. I have trouble stepping onto a curb. Again, could be indicative of weak leg muscles. I have to rush to the toilet. This rushing anywhere is often uh, not a safe thing to do, and especially at night if you have blood pressure, fluctuations. If you get up very quickly, you could get dizzy. If you can't see, if your pet is lying on the floor next to your bed, like there are just so many reasons why this matters. I have lost some feeling in my feet, so numbness in your feet can cause stumbles and lead to falls. I take medicine that sometimes makes me feel lightheaded or more tired than usual. Lots of medications have side effects, and we'll talk about that a little later too. Taking medication to help you sleep. I often feel sad or depressed. So symptoms of depression or not feeling well are also linked to falls. So if you add those up, and if you scored four or more, which is not that much, then you could be at risk of falling. So I think this is a helpful exercise just to kind of help, you and anyone else who may take this self-assessment that, gosh, I actually could be at risk of falling. I think it's easy to think, well, the neighbor down the road, I can see she's probably at risk of falling, or the lady in the third row at church or whatever, she seems unsteady. But no, it can be us too. So the Falls Free Dane Coalition, because of all this data and all this information that I just shared, the coalition formed, and it's a really vibrant representation from healthcare systems, senior centers, home health, academia, PT, United Way, EMS, ADRC, public health. It's just such a broad array of partners all coming to the table to discuss how can we reduce falls at both the systems level. So for practitioners, are we referring people to community-based classes? Or when somebody does call 911 for a fall and they're transported to the hospital, then is the hospital and the responders, EMS responders, are they working together with community partners? There's this whole tier, it's almost like a tree canopy that we want that to be tightly woven so that nobody is falling through the cracks. So at the systems level, but then also at the grassroots level. So are we offering programming and classes that's accessible to people? And one of the things we learned, I think, with COVID is that it's much more effective when we go to where people live and we meet them where they are. So we've started offering lunch and learn events in the community, mostly in senior housing, sometimes in senior centers. Um, Provide lunch, we provide resources to better just really meet people where they are and to get these resources out into the public. So that's kind of the Falls Free Dan Coalition, and we really are focusing not just on falls prevention, but on falls resiliency. So how can we, everybody, because we're all aging, be empowered to have the tools to know what to do if a fall happens, because we can't say they're never going to happen. It might happen. But how do we prep ourselves to know what to do and to be able to bounce back from that more quickly? So, some proven strategies include home safety, that's a big one, which we'll do a deeper dive into. Medication management, your vision is changing, our vision is changing every year. So, it's very important to get that checked. And strength and balance exercises are so important in giving us those tools that we need to know how to prevent a fall and know what to do if a fall happens. Because a big piece is if you do fall, how do you get up from a fall? It's really important to even practice that, to practice and to make sure you have the strength to be able to get up. If you're, I mean, definitely don't move if you're seriously injured. But a lot of times it's a strength issue and people are not able to get up from a fall. And the longer you lay on the floor, the worse the health outcomes could be. So I'm going to show a quick video. This is from the Centers for Disease Control, and I'm going to cross my fingers. We tested this before. We all joined together, but hopefully this works okay.
Life is all about balance, and so is fall prevention. That's where STEADY comes in. STEADY is a CDC effort to help older adults prevent falls. You can reduce your risk of falling by taking some simple proven steps. Start with strength and balance exercises. These are activities that help you improve your balance and make your legs stronger, like Tai Chi. You can do these activities at home, in the gym, or even in community centers. There are other things you can do to stay safe, healthy, and independent. It could be something as simple as making sure you're wearing the right shoes. You may need to consult with your doctor or a specialist about which footwear is best for you. How about your medications? When's the last time you talked to your doctor or pharmacist about all the medications you're taking? Remember to include supplements, any over-the-counter medications, and any possible side effects you're experiencing. The way our bodies process medications can change as we age. This can result in side effects that make us more likely to fall. When's the last time you had your vision checked? Poor eyesight can increase your risk of falling. Getting an annual eye exam is a good way to find and fix any issues. What about safety around your house? You can use CDC's checklist to find and fix home hazards, like removing clutter and throw rugs, and by adding non-slip mats and handrails in bathrooms. Above all else, it's important to talk to your healthcare provider. If you feel unsteady, have had a recent fall, or are worried about falling, bring it up. Your provider can help you stay safe and independent longer. You are in control. The most important thing to remember is that falls are preventable. Visit CDC's STEADY website for more information and helpful tips on staying safe, healthy, and independent.
All right. So that
Ashley, I'm real sorry. I didn't want to interrupt. I could hear the whole video, but I didn't have any video. Did anyone else have that issue? I'm not seeing anything. Yeah, I heard it, so it was still good, but I just didn't
Oh
see it.
no.
So maybe if you have another one, we'll just make sure we have the video with the audio.
Perfect. The next
Okay.
one, especially, we really need the video
Okay.
with the audio. So,
Okay,
okay,
great.
thanks for letting me know, Kate.
Yeah.
So that's just, well, what you heard is a great overview of some of the effective strategies to prevent a fall. And this is based, from the CDC, and also what we incorporate into our programming. So to break it down a little bit further, there are kind of four primary buckets. And I'll talk about this in a little bit, but we call, well, I'll talk about that in a little bit. So, home safety. So, the assessment, the self-assessment we just went through, also using assistive devices, which is very important to do if you need them, but it's important to make sure that we're using them the right way. The safety examples that you heard in the video, like removing clutter, throw rugs, making sure you have a great lighting in your home. And then even your shoes, the shoes you wear. So it might be time to retire the high heel shoes and look for more supportive shoes um, that, not flip-flops either. Might need to retire those too. Talk about medication. So research has shown, and I can't remember the exact number now, but once you reach a certain number of either medications from your pharmacist or supplements or vitamins, anything, that your chances for a fall increase. So it's really important to talk with your pharmacist about everything that you're taking, and to go through what's called a comprehensive medication review. So if you ask your pharmacist about this, don't quote me on this, but it used to be that Medicare would cover one comprehensive medication review each year. Because I know not everyone gets their medications from the same place. So you might have a mail order that you use, or then you might also use your local pharmacist. So they are not talking to one another. And we also have multiple uh, healthcare providers in our lives, and they may not be talking to one another. So it's really important to look at the comprehensive view of everything that you're taking, because one type of medication could be interacting with another one, that could make you dizzy or weak or even, pass out. And so those are things that we want to avoid. So it's important to have that medication review each year. Also your vision. So our vision changes. I've noticed every year my vision is changing more and more every year. So it's really important for that regular vision check. And we have some amazing local resources in Dane County. The Wisconsin Council of the Blind and Visually Impaired is such a great resource. They've got adaptive tools. They have experts who can walk you through how to use some of these tools, and I think they're still on Willie Street. And we tap into their expertise for a lot of our classes that we offer in the community. So also strength and balance, it's really important to continue to work those muscles that allow us to get up from a chair or to step over a curb, and just to navigate daily life. So it's important to practice specific, though, exercises that do improve strength and that improve balance. So this is what I've heard from lots of physical therapists, that walking is fantastic. It's great for your heart, but it doesn't get at that specific the strength and balance piece. So it's important to you to participate in exercises that do that specifically, and also walk and do your cardio. And then confidence is at the middle of all of this, because when you are more confident, you are actually less likely to fall. When you're more confident in your ability to navigate life, to go to the grocery store, to go get your mail, and this is based on research that a lack of confidence may actually have the possibility to lead to a fall. So that's kind of at the center of all of this. So now here's a little activity. So does anyone have an idea what room in the house do most falls occur? And you can hop off mute or put it in the chat, whatever you want.
I'm gonna guess bathroom. Anybody else have a guess?
Okay.
Someone else said bathroom.
Bathroom. Okay. That's a good
Yeah.
guess. That's a good guess. So falls, now here's where to be clear. So falls with no injuries often occur in living areas and bedrooms. So falls with the worst injuries often do occur in the bathroom because of the very hard surfaces and the sharp edges. So um, no one wants to fall, period, but you really don't want to fall in the bathroom. So this is just based on where falls occur with no injuries. And that was a trick question, I realized. I should have said falls with no injuries. Okay, what room in the house? Oh, okay, here we go. Well, let's just move on, because this one, you see the bathroom is now up here with living room and bedroom. So falls happen in places where we are most often, which makes sense. The majority of falls, for people who call 911, occur in their home. So that's where you see the data and the high numbers. It's where we are, where we live. Um, but you can see here that now the bathroom is included with falls with injury because of those hard surfaces, the tile, the sharp edges. So That's why it's really important. Well, I'll talk about this resource in a minute, but to have grab bars and the grab bars that don't suction onto your shower because those can be dangerous. To have raised toilet seats, and there are lots of things that you can do in the bathroom to help just provide an extra level of safety.
Thank you for everyone who was in the chat, by the way. Most of us did say bathroom and one person said kitchen. We were a little far off in the living room, but um, thank you for chiming in, everybody.
Oh yeah, I didn't even see that. I'm so caught up in this. So yeah, just you and feel free to jump in, everyone. So this one might be fun if you do wanna, if you feel comfortable coming off mute. So what do you see in this room that could be a fall hazard? Any thoughts?
The cane lying on the floor?
That's a good one.
Someone's saying the rug, shoes, cane, newspaper. Someone said the rug.
Yes, yes, and yes. All the above.
Yeah.
So yeah, you all have identified many of those hazards. You see the shoes that are lying under the table, the kind of the clutter here and there, the tables and chairs that are kind of close together that don't give you much room to navigate, around. The throw rug, throw rugs are big ones. Yeah, so well done, everyone. Everyone gets an A here. Okay, so what time of day do most falls happen? So you can see from the table here that it's usually the middle of the day, which, makes sense when people are out and about more. But it's helpful to know this information just because then I think it helps us be more aware. Little things like you bring a bag of groceries home and you need to go up the stairs. So maybe instead of carrying two bags at once, just carry one and just make an extra trip later or put your keys down so you can really just carry one bag and hold on to the handrail. There are just things, I think mindfulness is something that is a message that we want to really drill home just throughout all of this, just being mindful.
That surprises me, Ashley. I would think that most falls would happen when we're tired for some reason. Like, so I would guess like first thing in the morning when I'm kind of groggy and I'm stiff. But so that's interesting information. That's counterintuitive to me. So
Yeah,
I'm definitely going to mark that down. I mean, but you're right. When we're most active, it's just more movement equals probably more chances to misstep or to fall.
yep. And that's a good point too, because something else that was counterintuitive, this was several years ago. I was looking at some data because I thought, well, falls, it's going to be winter. Like, definitely, that's when
Yeah,
they're all
ice.
going to happen.
Absolutely.
But there was one study, and I'm not going to even reference it because I'll get it wrong, but that it showed that the highest fall incident was actually in the summer
Hmm.
because people are out and about. And the kind of the EMS data shows us that too, that when people are moving more, which
Yeah.
that does kind of make sense.
Yeah.
I'm not going to go through this. I just want to show this as a resource that you could look into later. But the Falls Free Wisconsin Center, it's all online, and they've got so many great resources, and one of which is a home safety challenge. So this is an actual home in Wisconsin, and you can click through, and it's kind of fun. If you like video games, maybe this could be right up your alley. But you go in and you identify like what are the hazards, and then it tells you like, yes, you got that right, or there's still one more, and then it tells you why that is, and you can progress through each room in the house. It's really great to increase awareness about things that we may not think about on a day-to-day basis. So now I want to talk about something that one of the committees of our Falls Free Dane Coalition has been working on for, gosh, the past maybe 10 years now. This committee formed. It's called the Keys to Better Balance, and it is a group of mostly physical therapists and occupational therapists who came together and they were having this discussion about stepping on specifically. And I'll talk about stepping on. For those of you who don't know, it's stepping on is an evidence-based falls prevention program. It's fantastic. It's not an exercise program, so it has an exercise component, but it touches on vision, home safety, medications, safe footwear, kind of the things we've been discussing. But after somebody takes a stepping on workshop, which is 7 weeks long, then what? Like, how do they continue to engage in some sort of program in the community that's going to help them on their falls resiliency journey? So this group came together and they decided, like, gosh, there are lots of classes in Dane County that actually probably do improve balance, but they're just not promoted as such. So they looked at research and identified what are the actual keys to better balance? So that includes, you can see from the infographic, strength, dual tasking. So it's doing two different tasks at the same time, dynamic balance, static balance, and in the middle of that, we just added last year confidence. So what this group does is they go out and evaluate all sorts of community classes, like ping pong, some water classes, some martial arts, dance classes, and they observe and they take down information. And if the class has a certain um, period of meeting each of these, except confidence maybe, keys, then they're awarded what's called the balance stamp of approval. So it's actually a logo. You can see it, it's right here in the top right corner. And they can use that logo in their promotional materials, in their newsletters. I know the Middleton Senior Center uses the logo in their newsletter for their classes that do meet the criteria for improving balance. So the goal of this is for anybody in the community looking for a class or program to more easily identify, oh gosh, that one has been awarded the balance stamp of approval. That one will help improve my balance. And on our website, the Safe Communities website, we have included evidence-based classes, so classes like Stepping On, um, and any balance stamp of approval classes in Dane County. So you can go to our website and see there's a calendar, what all you could find that could help improve your balance. So some of those are Tai Chi. There are lots of types of Tai Chi classes. Ballroom Basics for Balance is a very popular one. MSCR, a lot of their 50 plus classes have been awarded the balance stamp of approval. Living Falls Free. Um, so the list goes on. So you can go to our website to see these, but I did want to show, and I really hope this video works. So if not, I will, oh, I didn't mean to do that. If not, then I might try to go out of the presentation and just pull it up in YouTube to show you. Um, but this is hot off the press. We just received some grant funding to create a video about why the balance stamp of approval. What's the value? So, okay, fingers crossed. Kate, yell at me if this doesn't work.
Okay, I will let you know.
Okay.
Safe Communities is a nonprofit.
You can't see anything. Okay, thank you. I'm going to hop out of here and here. I'm going to stop sharing just for a second. I'll see if I can pull it up just directly. All right, I'm going to try this. Can you all see this?
Yep.
Okay, now let's hope the audio works.
Safe Communities is a nonprofit injury prevention coalition, and we organize coalitions around the top causes of injury death in Dane County, Wisconsin. And that includes suicide, traffic crashes, drug overdose, and falls among older adults. We do this work because it's important and it saves lives. The Falls Free Dane Coalition started because we, as an organization, started implementing an evidence-based program called Stepping On, and has been proven through research to reduce the rate of falls among program completers. Falls don't discriminate, they can happen to anyone, but we have so many amazing tools and resources to help
prevent a fall and to increase resiliency. And I think that's what we all want as we age.
When you've had a bad fall, you realize that your life can change immensely. And if you want to be able to have your life and do the things that you like to do, you'd better not fall again. I will never forget the horrible feeling of being on the ground and not knowing exactly what had happened and realizing I couldn't move. I realized I needed help, but I also needed fun. I have been part of this program for probably 10 years, maybe. The parkour for seniors class is one of them. That is amazing.
This committee started evaluating all sorts of community-based classes, and as the balance stamp of approval or the BSOA was awarded, then we would gather that information and promote those classes. So our goal with this work is to really increase accessibility for people. And at the statewide level, we're hoping to share how we're doing this in Dane County with others so that other coalitions and entities across the state can do the same thing. Wisconsin is actually #1 in the country for fall-related deaths. And I would love to see those numbers change. So many people say, gosh, I can get on the floor and play with my grandkids now. And I couldn't do that before. Or I can get up from my chair so much easier than I was able to.
It has allowed me to move more than I have moved since I was a little kid. This program is so much more than not falling down. Is a way to kind of leap into a very rich, holistic way of living as an old lady. This program is accessible and doable.
These classes are allowing people to live the way they want to live.
I was so afraid of falling. I don't have that fear anymore. It's a difference between living in fear and living with intention and mindfulness and not being afraid.
Well, I'm sold. That looks fun.
Oh my gosh. And isn't Alice just the best? She's a
Yes.
participant who, oh my goodness. It's it's really just remarkable what some of these classes have, I think, brought to the community. So let me go back here.
Are you going to show us where to find those classes, or is that on a website?
Yep, all of those classes are on our website.
Okay.
So all of the classes that have been awarded the balance stamp of approval are on our website.
Okay.
And you can
Which
also
is
reach out to me directly if you want.
okay. So it's safecommunities.org or something?
Yep,
Okay.
you got it. You got it. Yep. And then if you go to our website, because we do cover so many different issue areas, you'll just find falls and then go to classes. And then it's actually broken out by levels. So the vast majority of the classes that have been awarded the balance stamp of approval are for individuals at low risk of falling. So like the senior parkour, ballroom basics, that's for lower risk. And then, there are some that like stepping on more medium risk. And then we always recommend if you are at high risk of falling, talk to your physician because it might be that physical therapy is the most appropriate first step before engaging in the community classes.
Great.
So just because I happen to coordinate stepping on, that's the one I have control over, I'll talk a little bit more about stepping on specifically. So it's a multifactorial class, which I was mentioning. It's not an exercise class. So we have guest experts come in, including a physical therapist, an occupational therapist, vision expert, EMS, and a pharmacist, and talk about their area of expertise and how specifically that relates to falls. It's 7 weeks, 2 hours each week, and then we have kind of a follow-up booster session around 3 months after the workshop concludes. And there are 10 to 15 people in each class, and we will offer this anywhere we can get at least 10 people. So it doesn't, it just so happens to usually be senior housing, senior centers. We've offered it at public libraries before, Parks and Rec. Faith-based organizations. So really anywhere we can get 10 people. And it's most appropriate for older adults who maybe have fallen or have a fear of falling, but also who are mobile enough where they don't rely on an assistive device inside their home. If someone uses a cane or walker outside of their home for extra stability, that's fine. But because there is an exercise component, we want people to be able to participate. And it's $35 for the full 7 weeks, but we always provide scholarships, no questions asked, for those who need that assistance. So those classes are also on our website. So speaking of the website, nice segue here. So the risk assessment that we took as a group is included information about the Falls Free Dane Coalition, and I would invite anyone on this call, if you are interested in being part of this coalition, we would love to have you. We're always looking for new perspectives, and it's a very lively group, and I think it's going to take all of us to really change the numbers that we're seeing in our community. So just reach out to me directly if you want to attend. We do meet early. It's 7:30 in the morning, but it's over Zoom. And it's mostly every other month. And we do have, I forgot to mention this, every September is National Falls Prevention Awareness Month. We have a really big event called Only Leaves Should Fall, where we have Dr. Zorba Pastor come speak. Um, we partner with Madison College and UW-Madison, and participants are able to progress through a series of screenings, and they have kind of a checklist. So, balance, gait, vision, cognition, medication. And so by the end of the event, a participant can kind of look at their checklist and not only identify what their fall risk might be, but what could be attributed to that risk. And then we have community resources available. It's such a fun event. We don't have it scheduled yet for this year because we rotate. We actually use that EMS data to help us identify where to have the event, and it's always free. So just look for information about that. I'm sure Mike and Kate will get information out too once I send it out to everyone. So anyway, back to our website, you can find local resources. So if you are interested in a home safety assessment, there is an organization in Dane County called Safe at Home. It's part of SAIL, and they offer free home safety assessments for older adults. I think it's 55 plus. All you have to do is call. Information about that's on our website, or you can just email me directly. They are amazing, and they provide such great guidance on how to stay safe in your home. Again, the BSOA classes are on our website. And if you're interested in kind of the research behind the BSOA, all of the documents are on our website. And also, if you don't want to maybe participate in a community class, you can also do things at home. So while you're brushing your teeth, maybe hold on to the counter, but stand on one foot. When you're waiting for your lunch to heat up, you could do side steps down the counter. Always having that counter though for support if needed. But there are things you can do at home too. So it's not, we don't want people to feel overwhelmed. Like there's no way I can do this. It's just too much. There are little things you can do. And then on the right here, these are just some national resources. And also Falls Free Wisconsin, like I said, fantastic resource. And it is Wisconsin based. So I think that is it. So that's a ton of information and maybe a little overwhelming, but does anybody have questions about anything?
Feel free to put it in the chat or holler it out at this point. I have a question about shoes, if you don't mind, Ashley. I know when we were kind of very briefly talking about it, and you said definitely no flip-flops, that kind of thing. I guess I'm kind of wondering what shoes are the best for a fall profession, and are there like indoor shoes versus outdoor shoes? Like, how do you feel about slippers, those types of things?
Oh yeah, slippers are a big one. I would say those it depends on the type of slipper, but having support around the heel is important. So the ones you just kind of slide your foot into maybe aren't the safest.
Okay.
But what we recommend is Morgan Shoes at Hilldale. They're a great resource. They'll help people. We usually refer people to them to like identify what's a good supportive shoe that would help keep you safe.
So, Rebecca from APS kind of chimed in on the chat and she said, well-soled slippers. So things with like really maybe soles with integrity, right? And then what you're
Yeah,
saying is make sure you have heel support. So no slip-ins of any kind, something that you can actually slide your entire foot into. Is that what you're saying?
that's the best. I think with
Okay.
that, the heel support and also, slippers that you just slide into often, they wear down quickly and
Yeah.
they get really slick on the bottom. So hence the sole is
Yeah.
that is important. Yeah. Thank you, Rebecca.
All right. Any other questions about the content or about resources? You can reach out to myself or Mike. Mike is the one who sent you the Zoom link, so you should have his email address. But anyone at RSVP or Ashley Hillman with Safe Communities is a great resource. Okay. Well, thank you so much, Ashley. This was really, really good information. I'm going to be looking at all those fun resources because I'm kind of a community exerciser. That looks really fun. So we're grateful. Yes, thank you so much. And any questions last minute before we go? Well, thank you everybody for coming. I hope you walked away. You can walk away with some more information. Oh, I'm getting a lot in the chat that they're saying, thank you, great presentation. This was so helpful. I agree. Yes, this was all really good data and good resources. So thank you, Ashley, for all you do for the community. We're grateful. Thanks,
Thank
everybody. Enjoy
you.
the
Have a
day.
good day.